Namaskaram, the South Indian is here, and the South Indian is very clear that if there is something which is most important, more important than politics, more important than policies, more important than sports, entertainment, it is an individual's health. You and I know how the world had actually shut down 3 years ago because of that one C word. And guess what? Even as the world is gearing up for the festive season for Christmas and New Year, a new COVID-19 subvariant, JN.1, has reared its head yet again. This is a rather unfortunate combination, festivals and infection. For example, in Singapore, in the first week of December, the estimated number of COVID-19 cases rose to 56,043. And the country, even as we speak, is on very high alert. The Ministry of Health in Singapore has advised mask usage in crowded places, particularly indoors, and urged travellers to adopt precautions such as mask wearing at airports and avoiding poorly ventilated crowded areas. My God, it brings back those memories, remember? Now at home, Kerala is seen to be particularly vulnerable as the virus has been detected in Tirunelveli and Kannur districts, and within a week, COVID-19 cases in Kerala increased 277%, reaching the highest number since May of 2023. Unfortunately, 10 deaths have also been reported in a span of a month in Kerala. I said earlier and shall once again repeat how the festive season is indeed a huge concern, as the infections may further increase due to the movement of people. Let's take a look at the statistics, shall we? On 16th of December, Kerala reported 302 new cases, and this was an increase from 10th of December when the state had reported 109. So what we are seeing is daily new COVID cases started to cross the figure 200. The Health Secretary has stressed on the need for maintaining constant vigil over the COVID-19 situation and to increase the number of RT-PCR tests. Neighbouring Karnataka is also on high alert as it shares a border with Kerala. Health Minister Dinesh Gundu said the COVID-19 Technical Advisory Committee, they met today and to discuss the impact of the new COVID-19 subvariant, and earlier he had said, and I am quoting him, of the 58 active COVID-19 cases currently in Karnataka, 11 are hospitalized, 5 in ward and 6 in ICU, while the remaining are in home isolation. There have been no deaths reported in the past 2 months. That's what Gundu Rao said. However, one death of a 64-year-old has been reported from a Bengaluru hospital on 15th of December. The patient, said the minister, had multiple comorbidities and COVID-19 was an incidental finding. So, ladies and gentlemen, what do we know about this subvariant? For one, it's considered to be a descendant of the Omicron subvariant BA.2.86 or Pirola. Going by its trajectory, it was first detected in the United States in September of 23, and later China reported 7 infections of the same subvariant as recently as 15th of December. The subvariant was identified in a woman in Kerala, raising concerns even as the Union Ministry of Health initiated preparedness measures. Now, what is also being said is that the BA.2.86 has a total of 20 mutations on the spike protein, which is of course a cause of concern, and all this, don't worry, will be decoded by the experts who are joining us on the show. What are the symptoms? Well, right now on your screens: mild fever, coughing, discomfort in the nasal passages, sore throat, runny nose, pain or pressure within the face, headache and gastrointestinal issues.
One thing is, people actually have completely forgotten about the whole keeping the distance kind of thing, and wherever you go, they don't, they completely are not using any mask, or the social distancing is not even happening. And I think people kind of want to forget whatever happened in the past and they want to move ahead. So they think that the COVID does not exist now. So because of that ignorance, there is increase in number of cases. Apart from that, this virus is actually capable of mutation. So even if we use all the precaution and everything, it's going to come back. it's going to be there for a very, very long time. It won't actually go.
Meanwhile, the Karnataka government has released COVID-19 guidelines after Health Minister Dinesh Gundu, like I said earlier, met with the Technical Advisory Committee following an increase in the subvariant cases in neighbouring Kerala. As per the guidelines, all the elderly above 60 years, also people with comorbidities such as kidney, heart and liver ailments, pregnant women and lactating mothers are advised to wear face masks and strictly avoid visiting closed and poorly ventilated spaces. Also, all those with respiratory symptoms like fever, cough, cold, running nose will have to seek medical consultations early. They should also wear masks and avoid visiting closed spaces. Also, good personal hygiene maintenance, including frequent hand washing, etc., is advised. Like I said, bringing back memories. But you know what? We can't possibly relegate the past to a back burner if we have to move forward. So, therefore, ladies and gents, let's now speak to experts to understand what is really going on. Dr. A. Altaf, Professor, Community Medicine, Government Medical College, Thiruvananthapuram, he is joining us, and also Dr. Sanjeev Bagai, very renowned Chairman, Nephron Clinic, is also joining us live on the show. A very warm welcome to both of you. Dr. Altaf, I want to come to you first. We've heard Veena George. We've heard several doctors. Rajiv Jayadevan was with me yesterday, who did this show with me. Now, today I have you. You are very well known when it comes to, community medicine. Everyone is saying, do not panic, but the point is, in a span of 1 month, there have been 10 deaths, Dr. Altaf. I know that deaths are also relative, maybe you look at it in a relative fashion, but the point is that what is going on?
Actually, right now I would like to emphasize for the word no panic. Actually, we have to give more emphasis for this. Actually, we have to convey the message that there should not be any panic in this situation. Even WHO, World Health Organization, declared the end of pandemic or end of the stage of public health emergency in May 2023 itself. So there is no concern about COVID variant so far. And the recent variant JN.1 is a subvariant of Omicron, which is having a note of lighter manifestations, very with regard to mortality as well as the morbidity. Comparing with all other strains, actually it is very. The only thing is it spread faster, as well as it has the capability of immune escape.
You're absolutely, Dr. Altaf, you are absolutely right. Yesterday when I did the show, I always say no panic. The more you panic, the more mistakes you are bound to make. Even a little child knows, when you take the child for an injection or a shot, we always say, look at that tree, look at that beautiful picture, do not panic. We are trained to not panic. But the point is, there is a very thin difference between being not panicking and being totally blasé about it. For instance, let me tell you as a journalist, in Kerala, I saw some protest yesterday. No one was wearing a mask. Why?
Actually, wearing mask as a strategy during the ongoing stages of a pandemic or in a situation of public health emergency. But right now there is no such situations, and wearing mask by the public is to prevent the community spread of a pandemic or an epidemic at that situation. Here actually there is no such situation existing right now, and we have to promote wearing mask, especially in crowded places and hospitals. Actually we can promote that thing, but actually we cannot make it mandatory at this point.
No, and, it's not about mandatory, sir. I mean, I'm not saying anyway. I'll come back to you, Dr. Bagai. This subvariant, this JN.1, there are different reports, I mean, I'm not a doctor, so I want you guys to actually decode it for me. One of the points is that, this variant has an enhanced ability to evade human antibody response. Dr. Bagai, for the benefit of the viewers, what does that mean?
Hi, good evening. Thank you for having
Hi.
me. Good evening to all the viewers. So let me break it down at a layman language, but a molecular level.
Yeah.
These particular variants, it's not only JN.1, which is more dominant now. About 18% of the global sequential genomic sequences is of JN.1, but there's JN.2, 0.3, 0.4, going up to 0.7.
Okay.
But this particular one is a breakaway of the Pirola, which was BA 2.86. And unfortunately, this has added on to a sleeping mutant of Pirola, a particular specific mutation, which is LS455. What this particular amino acid mutation does is, it makes your binding sites closed for the antibodies to protect you. So your cells in your upper respiratory tract are left vulnerable and open to attack from the virus. These are convergent mutations. That means a lot of synonymous and non-synonymous repeat mutations happen very closely clustered together in the genomic code of the virus. And the antigenicity is very different from compared to the previous mutations. What this immune evasion does is it breaks away from a double vaxxed or a triple vaxxed, or indeed now there are reports from 4 vaxxed patients, even with the updated bivalent vaccine. It has a greater breakthrough infection, a greater recurrent, what we call as reinfection, and the so-called hybrid immunity, what we are now calling as immune imprinting, is now a passé. It's a thing of the past. Hybrid immunity is not giving you adequate protection. The particular virus, once it enters into the body, it releases a huge, this particular one of JN.1, it releases a huge amount of what we call as coefficient energy, and it binds on to your cells. But it doesn't bind to the ACE receptor cells. So it is more transmissible, it is more immune invasive, but at the cost of being less binding to your ACE receptors. But it has an alternate path to enter.
It all sounds very scary, but of course you are the doctors, you must know. Dr. Altaf, is it true that this JN.1 spreads very rapidly? Is it true that it spreads where it may not be something which may, lead to dangerous proportions, but it spreads very, very fast? Is that right or not really?
I can give a specific answer for this particular question. Only while we are testing all the influenza-like illness cases, if we are testing in that scenario only, we can say the infection is spreading very fast, and it is going to make more mortality like that. Right now, Kerala has tested more, so we got more number of cases. In other states, if we test more tests we conduct in other states, we will get more cases from other states as well in other countries. Almost I think more than 70 countries reported this JN.1 variant. So and almost all places it is reported like having less morbidity and less mortality like that. So in our context, if you want to say like that, for your question, we have to test a large number of cases, suspected cases.
All right.
Then only we can say.
Okay, Dr. Bagai and Dr. Altaf, please do stay with us, because ladies and gents, I'm taking a break right now, and I'll be back, and we are discussing something which is very important and concerns all of us, a new subvariant of COVID. Don't go away, coming back in a jiffy.
हमारी नारी शक्ति को सशक्त करने से ही देश सशक्त होने वाला है।
हर महीने महिलाओं को 1500 रुपए प्रति माह दिलवाया जाएगा।
What Nitish Kumar did to provide cycle to girls, so they could safely, quickly move out of the house, go to school, and quickly come back. Ching, 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 ching.
माँ अन्नपूर्णा तू ही, माँ अन्नपूर्णा है तू ही बीणा वादनी, हे शक्ति स्वरूपा जगदम्बा, हे नारी तू नारायणी।
News is now content. just stream it. Download the world's first news OTT, News9 Plus, ahead of the curve.
Welcome back. We're discussing about this new subvariant, which is JN.1, and due to which the 10 deaths have been reported in Kerala. There is also a high alert in neighboring Karnataka, where everybody above the age of 60 has been advised to wear a mask and avoid crowded places. I am being joined by Dr. A. Altaf, who is a professor community medicine, Government Medical College, Thiruvananthapuram, and Dr. Sanjeev Bagai, chairperson, Nephron Clinic. Dr. Bagai, I want to come to you and ask you, if WHO said no more, I mean, when that happened, announcement happened, we all heaved a sigh of relief. It's almost like, okay, we've all been through it, and thank God for small mercies that some of us are still alive. I lost a lot of friends. Sure, the world lost a lot of friends and relatives. But tell me, Dr. Bagai, this is one question which we need to ask, because I'm getting a lot of queries. Do we have to live with this forever, Dr. Bagai? Some mutation, some subvariant, something or the other?
I think this is a very pertinent question. I think the nature of an RNA virus is to continue to mutate. It's an evolution. This expected or rather unexpected combination mutation of adding on a very, very slippery mutation, which is making it more invasive, more immune invasive, is unfortunate. But I think over a period of time, this is bound to find some sort of level in a community, what we call as community acquired immunity. Although a true level of endemicity will never be achieved because it will continue to mutate. The fortunate thing is this is not as deadly, as infective, as lethal as the Delta wave, the second wave in India is, but it is still much more than the original BA.2, which is the Pirola. So I think we will have patients who are coming in with high-grade fever, persistent new cough. This is a very important feature. Persistent new cough, upper respiratory symptoms, headache, chills, gastrointestinal symptoms, rashes, eye infections. So I think the index point here is early diagnosis, early isolation, therefore no panic. If you isolate yourself, in all probability, 99% of the time, without comorbidities and any predisposing illnesses, you will recover spontaneously. There is no need of any antibiotics, no need of combination painkillers, just simple paracetamol, isolate yourself, but testing is important, and I think that's where most of the areas in India are lagging behind. Over to you.
All right. That's very well said, Dr. Bagai. Dr. Altaf, tell me something. You know, there is also a miscommunication and rather misreporting. They're saying, oh, it's happening in Kerala. I mean, I would like to remind ladies and gents that the kind of example Kerala set, and under Shailaja teacher as we knew her, and also Veena George, they've done a stupendous work. It's not only about that both are women, but which is of course a great thing. But you know, we became an example across the world, the way Kerala could actually control COVID, and has also been working relentlessly towards putting a lid on Nipah. So it's not as if it only happens in Kerala. Maybe Kerala tests much more than what you and I do in different states. Tell me something, Dr. Altaf, is it true that the person, the elderly woman around 79, they say somewhere close to Kannur, was it, you know, who was detected with this virus, it was tested and it was found to be this subvariant. Was it also because Kerala has a heavy traffic of people going in and out of the country?
Yeah, that might be another reason. We have almost 4 international airports and around 10,000 passengers traveling through these airports every day. So anyway, there is a chance of, regarding the spread of pandemics or epidemics, especially the newly emerging infections. One important reason is the migration of people and international travel, increased international travel. Kerala actually, in that case, actually Kerala is an example of large number of people are traveling, but the migration is going on like that. So there is a chance for getting new infections getting introduced first in Kerala. There's a chance. Another reason is, as you mentioned earlier, we have a very robust surveillance system, and that is why we are detecting it early. That's another reason. So, of course, all other factors are common for all other states across India. The climatic changes, and the environmental variations. Everything actually it is prone to spread more new infections, especially the density of population, all other things. But Kerala, actually, the particular points are, one thing is the large number of migrant population as well as the international travel. That is important.
Dr. Bagai, I want to come to you. Again, a very pertinent question, I would reckon, is that are you prone to get this subvariant even if you have waxed, completely waxed, and also have had a booster, like in my case?
Small question, but a huge question. So the answer to this huge question is that this particular JN type 1 is what we call as genetically the fittest virus subvariant. It has the maximum immune escape to single wax, double wax, triple wax, and even quadruple wax. It is escaping even the new bivalent vaccine, which is XBB 1.5 containing. So we need to be careful because the vaccinated people can also have damage from this virus. Also, if you've had a past natural infection of any type of the sublineages of Omicron, you can still get it again. Therefore, what I had said, it has a higher breakthrough infection and a higher reinfection rate, and there are genetic reasons for this. But having said that, every recurrent infection predisposes you for further long COVID. So I think it's important to protect yourself. It's not good to say that it's mild, so I can get it. Getting COVID is not a good idea. Even if it is a mild COVID, it is not a good idea. We are reasonably well protected in India because we've got a sufficient amount of inbuilt immunity, innate and adaptive, because of the very strong vaccine campaign in all the states right at the beginning. So we just need to be careful. Isolate yourself if you have symptoms. Avoid crowded places. If you are in a very clustered area like airports or in an aircraft or in a very close, clustered, poorly ventilated places, try to avoid it. But please wear a mask specifically in those areas.
Dr. Bagai, very bad timing to kind of, be faced with this subvariant. We are, we're going to all celebrate Christmas. We are traveling from one place to another. The children are coming back for vacations, who are studying abroad. And, the thing is, there is going to be New Year's, there's going to be travel. We're going to go to gatherings where there are going to be people. I mean, don't you think that timing is awful, Dr. Bagai?
Yeah, I think that's law of nature, but I think it's a very small burden to carry to wear a mask. It's much better. I've always said this for the last 3 years. It's better to wear a well-fitted N95 mask, which is light, it's cheap, it's economical, it's not harmful, and rather than to have a tube down your throat in an ICU. So tide over this period. This period will be short. We know that India lags 4 to 6 weeks behind the rest of the world when the infection of this type nature starts. So it's around first week, second week of Jan, we may see a rise of cases. So I think it's just better to preempt it and be careful.
Right. Dr. Altaf, tell me something. Everywhere, I mean, right from the time that COVID has begun, when it isolated the world, even now with the subvariant, there is a lot of stress on how the elderly and the little children are particularly vulnerable. Now, a lot of people in my office have children who 3, 4 years old. They said, what do we do? I mean, also teenagers, and some of them are vaxxed. I don't know how, because they were traveling. I don't know. But the point is that are these two groups extremely vulnerable, Dr. Altaf? Or you just want people to be more careful and that's why it is said?
Yeah, especially the elderly. Actually, they must be more careful. That's all. And in most of the cases, most of the deaths, if we verify that they have comorbidities also, sometimes uncontrolled diabetes or other chronic diseases and even renal diseases like that. So in that conditions, the disease become more may become complicated and it may lead to death like that. So anyway, the advice we have to give the elderly people is to the advice regarding lead a healthy life, healthy aging and healthy life. Also, we have to advise personal hygiene. These two things we have to advise. They have to do sufficient exercise daily, nutritive food, take nutritive food, as well as personal hygiene, and as and when possible, they have to wear masks, especially while they are going to public places, crowded places, and hospitals. These are the things we have to advise the elderly people. And regarding the kids, actually, we have to advise personal hygiene. That is more important.
Dr. Bagai, would you say, and this is a question, I'm not sitting on judgment, but yesterday I did the same story because I'm going to really focus on this. It's a very important story to do. Yesterday, and I've read up most of the articles which are there in Indian newspapers and sites. Yesterday, we were still talking about 5 deaths. Today, suddenly it's 10 deaths, and apparently there are 19 deaths all over India. So, what happens is it's only natural for anybody to kind of be scared. And then we think in the context of Kerala, which is a super efficient state so far as controlling COVID is concerned. Would you like to decode that for the viewers so that there is less paranoia and panic, Dr. Bagai?
Yeah, I think it's still early days. Although statistics and numbers are extremely important because they give us a micro concept over a larger picture evolving. But like I said, it's a milder infection than Delta. It is more invasive than the original BA.2, 0.86, but not as bad as Delta. We in India are reasonably well controlled. I think many states like Maharashtra, like Kerala, even for that matter, Delhi, have done really well to control the infection in the first, second, and the Omicron wave. We need to re-emphasize 3 or 4 important things, and with your permission, I'd like to mention it.
Yes, sir.
It's to highlight, and the best way to highlight is the media platform, is to highlight the early warning signs, what we call as the red flag signs, is again to re-emphasize that don't be scared to get yourself tested. Do not worry about isolation. It's not a stigma. And last, most importantly is, in case you have, please notify it, screen the people who you've come in contact with. Don't self-medicate. It is generally, by and large, a self-medicating, self-limiting disease. People who are aged, above 65, hypertensive, diabetic, chronic kidney or chronic liver disease are more vulnerable. That is a well-established fact for the last 3 years. Those people specifically, especially in healthcare workers in hospital settings, closed areas, poorly ventilated areas, wear a mask.
All right. And on that note, both the doctors, please do stay with us because I'm going to take a break and come back. Ladies and gentlemen, just a break for a minute and then we shall talk yet again about the subvariant of COVID with the 2 doctors.
Jyotiraditya Scindia is also facing a litmus test.
There have been corruption charges against all the chief ministers or towering leaders who were rich, but this is not the case with Scindia. So the point is that in modern times when the society is looking up to good leaders, so Jyotiraditya Scindia could be one of them.
As far as Jyotiraditya Scindia is concerned, even if the BJP loses, Jyotiraditya Scindia will be around for at least another 2 decades. He is young and he has the ability to come back.
This and more streaming now on the world's first news OTT, News9 Plus. Download now.
Literally every major power in the world is gearing up with its own digital currency. And so is India. But India's UPI has taken digital transactions to the next level. So, with UPI already available, what exactly is the use case for the e-rupee?
This and more streaming on world's first news OTT. News9 Plus, download now.
ChatGPT. It can generate codes and human-like responses through text, write stories, and do a lot more.
I work in a newsroom with anchors, researchers and scriptwriters, graphic artists, producers, video editors, camera crew. But does a newsroom really need them today?
All of us have to think about unique and distinctive value addition that cannot be automated or repeated or replaced by a machine.
ChatGPT may kill many companies.
A human has to be in the loop with an ability to control this.
Dark Side of the Boom. Streaming now.
Delhi has the fastest growing metro network among G20 nations. From 6 stations in 2002, it today has 286 stations. Reliability, cleanliness and affordability have set the template for other Indian metros. The architect of this modern-day world-class marvel is E. Sridharan. Watch the extraordinary life of Metroman E. Sridharan streaming now on News9 Plus. Download now.
Welcome back here with the South Indian, and we are discussing the topic of a COVID subvariant JN.1, which is spreading its tentacles, but nothing to panic, nothing to really worry. And that's because we have 2 experts who are talking about it, and they are telling us ways and means about how you can be absolutely safe provided you take all the necessary precautions, which are actually very simple. Dr. A. Altaf, Professor Community Medicine, Government Medical College, Thiruvananthapuram, and Dr. Sanjeev Bagai, Chairperson, Nephron Clinic. Both of them are here. Dr. Altaf, I want to ask you about the preparedness. You know, from the center, the Health Secretary has been speaking about, and there is going to be more advisories which are going to come out about how we need to be very well prepared. Do you think Kerala is well prepared? I mean, wasn't there a time, I am not talking about Kerala, but some neighboring states actually had wound up all the beds, all the special facilities which were required for COVID treatment. How prepared is Kerala to handle, just in case, God forbid, something happens? Dr. Altaf, I think we've lost contact to Dr. Altaf. I'll go to Dr. Sanjeev Bagai. Dr. Sanjeev Bagai, I want you to kind of, focus. There he is. Dr. Altaf is back. Dr. Bagai, I'll come back to you, sir. Thank you for your patience, sir. Yes, Dr. Altaf, did you hear my question?
Yeah.
Yeah. Go ahead, sir.
I can hear.
Yeah, I can hear you.
I can hear. Hello?
So tell me, how prepared
Hello?
is Kerala?
Hello?
How prepared is Kerala, Dr. Altaf?
Yeah, Kerala is well prepared actually. In all the is prepared to deal all such situations for any kind of any other variants or any other outbreaks. The health system in Kerala is very well prepared. Even the public health system as well as the private sector also closely associating with the government system. In that terms, we can say Kerala is very well prepared. Even the variant is having much more morbidity and mortality, that the state health system is very well prepared. But right now, actually, we don't have any worries about this particular variant.
All right. So you say Kerala is very well prepared, although you do not, and I hope it stays like that, that you don't have to kind of, need more beds or any kind of emergency that is required for this. Dr. Bagai, Omicron also, after Delta, Omicron also created a bit of panic because it's all psychosomatic, it's more psychological. Remember when there were no oxygen cylinders and some of my friends, lost their elderly parents. I don't want to even go back and think about it. When you say the C word, now the C word is COVID. Oh, COVID ho gaya. Oh, we've got COVID. There is my grandmother who's 90 years old. Tell me something. If you have to grade it, then don't you think that this particular subvariant is a very, very docile child, compared to whose descendant it is, that is, perhaps Delta or Omicron?
Yeah, so I think the parent of JN.1 was a docile parent, which was the Pirola BA 2.86. Whereas this particular JN type 0.1 is a naughty child. And I think this child is still growing. So I think we need to keep a very close watch on this kid. It is going to play a little bit off traunt. I think we are going to be seeing more number of cases pan-India. I think most states are well prepared. The protocols are in place. I don't think we will need that much number of beds and oxygen because it's more an upper respiratory. Omicron is more an upper respiratory infection, whereas Delta was a lower respiratory infection. So I think that's a demarcating line. But I think we are reasonably well prepared. It will have more upper respiratory symptoms and high-grade fever and chills and headache and gastrointestinal symptoms. But yes, it is milder than the alpha and the delta and the beta waves. So from that point of view, it is better. But again, prevention is the best cure because even mild infection can lead to long COVID.
Dr. Altaf, before I let you go, tell me something. Those vaccines that we've had, like I had it 2 years ago, do you think it is still effective, or should one consult a GP and then perhaps go get another booster, doctor? Because will that vaccination help in every kind of a subvariant?
Not necessary, actually. If a variant which is causing more morbidity or more deaths, we have to be alert, and we have to develop such kind of vaccines for dealing with the new strains. Right now, there is no reason for booster doses of the same old vaccines.
All right. And on that note, let me thank both of you. Dr. A. Altaf, Professor, Community Medicine, Government Medical College, Thiruvananthapuram. It was a pleasure speaking with you. And Dr. Sanjeev Bagai, as always, very, very helpful chatting with you, sir. He is Chairman, Nephron Clinic. Thank you indeed, gentlemen.
Thank you. God bless you.
I'm sure Tamil Nadu must be saying, rains, rains, go away, because this has been like too much. After the cyclone, once again, we see relentless rains in some parts of Tamil Nadu. Even as heavy rains continue to pelt down parts of Thoothukudi and Tirunelveli, Tamil Nadu Chief Minister M.K. Stalin said on Tuesday that the state government took proper measures for rescue and relief operations on time, despite late warning which was received from the meteorological department, which mitigated the extent of the disaster.
வானிலை ஆய்வு மையத்தின் எச்சரிக்கை நமக்கு சற்றே தாமதமாக கிடைத்தாலும் அதில் அளித்துள்ள அளவை விட அதிகமாக மழைப்பொழிவு ஏற்பட்ட சூழ்நிலையிலும் தமிழ்நாடு அரசு முன்கூட்டியே பல்வேறு முன்னெச்சரிக்கை நடவடிக்கை எடுத்திருந்தது என்பதை இங்கே நான் சுட்டிக்காட்ட விரும்புகிறேன்.
I hope this does not become a big political slugfest, although Mr. Stalin is right. Apparently, he was told about that there are going to be heavy rains, but this heavy, perhaps not. Now, so far, 12,553 people have been evacuated from low-lying areas of 4 districts in Tamil Nadu to 143 shelter homes, and 3 people are now confirmed dead. Now, in the latest news, Tamil Nadu Governor R.N. Ravi convened a meeting with senior officials of central agencies and armed forces to review the situation in flood-affected southern districts of Tamil Nadu. Now the thing is that this also may become a slugfest because apparently Governor Ravi cancelled his usual program and decided to take stock of the flood situation, whereas you see that Muka Stalin, Chief Minister of Tamil Nadu, is very much in Delhi and is slated to also meet with Prime Minister Modi late night on Tuesday. The Indian Meteorological Department has predicted thunderstorms and lightning with moderate rainfall on Tuesday as well. A red alert is in place for Virudunagar, Madurai and Theni districts, while an orange alert is operational for areas such as Thoothukudi, Dindigul, Kanyakumari, Coimbatore, Tirupur and Sivagangai. I guess these are NDRF personnel on your screen right now who are helping with rescue and relief operations in inundated streets in Tamil Nadu. Now, schools and colleges also remain shut in Tirunelveli, Thoothukudi, Tenkasi and Kanyakumari. The deluge, intensified by cyclonic circulation, has caused extensive damage in the areas, causing disruption to everyday life. The 4 districts bore the worst brunt, even as rain refused to cease in the areas, and you saw homes being flooded, streets being waterlogged and people just praying for rains to give them some kind of a relief. Now, Kayalpattinam in Thoothukudi emerged as the focal point, recording 932 mm of rainfall in just 24 hours, surpassing the annual rainfall and standing as the highest ever recorded rainfall in the state. You know, some of the worst things are emerging from the southern Tamil Nadu, where rain has been pelting down incessantly. For instance, Manimuttar amid the heavy rains in the districts. The water level in the Amravati dam increased to 10,000 cubic feet per second, adding to the woes of the people who live in and around Tirupur. The government, of course, is planning to do whatever it can and gearing up with teams of NDRF and SDRF as standby, as landslides have also been reported in Kumuli, Kampamete and Podimete in Thennai. Water level has crossed 4 feet in Kanyakumari district, submerging most of the paddy fields in the river's bed. Relief camps have been established for those affected in low-lying areas, and like I said, there has been a lot of damage and devastation, even as the Army, Navy and Air Force are on high alert and several boats have been deployed for rescue and relief operations. Train services have been disrupted and cancellations announced for various routes like Tirunelveli Tiruchendur section and between Srivaikuntam and Seidunganallur. Southern Railway is making concerted efforts to restore traffic and evacuate stranded passengers. For example, at Sri Vaikuntham railway station, where track parameters were breached on certain sections, food packets were supplied to 200 passengers by the state police, but rescue and relief operations were severely impacted due to excessive flooding. So, those are the visuals of the rains and also the floods in southern Tamil Nadu. Coming up next, News9 special documentary on M.K. Narayanan. The former NSA M.K. Narayanan recounts why India refused to seek revenge for 26/11. That's coming up. And with that, the South Indian says goodbye, vanakkam, namaskaram. Southern Tamil Nadu, take care of yourself, stay safe.
The scale of the attack was something that we were surprised at. The elite